Hello, everyone, and welcome to New Life Show on AUK Radio. I'm your host, Yinka. On this show is your community for health and wellness and everything in between. We are here to provide you with information, general information. So please do consult with your healthcare provider in the first instance, especially if you're already under the supervision for whatever reason. We do not diagnose, neither do we cure nor heal any ailment or disease or sickness whatsoever. Now, with that being said, today I am excited because I've got a very special guest on the show. She's a big sister of mine, a health professional, but I'll come back to telling you a bit about her and get her to tell you about what she does in her role as a healthcare professional. So today, we will be talking about PCOS, otherwise known as Polycystic Ovarian Syndrome. What? What's that, you wonder? Well, I will let my guest tell you a bit more about that. But before then, here's the definition and some statistics for you. So PCOS, also known as PCOS, stands for Polycystic Ovarian Syndrome. It's a common hormonal disorder that affects women and people with ovaries, typically during their reproductive years. So, PCOS is a condition where the ovaries produce an abdominal amount that is a higher than normal amount of what we know as androgens, male hormones. Male hormones, which are usually present in small amounts in women. It can affect a woman's period, fertility, appearance, and long-term health condition. So it's vitally important that we educate ourselves on what PCOS is and to know the symptoms and, of course, know what we can do if you or someone you know have PCOS. Last year, 2024, the UK did a study or statistics of collecting people's view on what PCOS is. About 72% of the people interviewed had one or two of the symptoms of PCOS and didn't know it. And so many other people do not know what PCOS is. So you're here today to get educated about PCOS, knowing what it is, and how to help yourself or a loved ones. So with that being said, I'm going to bring my guest on to introduce, I will introduce her once I bring her on, and she's going to tell us all about this condition called PCOS. Hi, Assis. Welcome.
Hello, hello, Yinka. Thank you
How are
for
you?
having me.
You're very welcome,
Very
and
well,
thank you
thank you.
for honoring my invitation.
Thank you.
Right, would you like to introduce yourself to our viewers and listeners, please?
My name's Lydia Olorunniwo. I'm actually a nurse by background, qualified in 1992, and I went on to do different other things and different courses. Since 2016, I moved into the community in primary care as well as primary health care as a specialist nurse and a public health nurse as well. So now I've been mostly a practice nurse with special interest in dermatology and in
Tissue
functional
viability.
medicine as well. Tissue viability and functional medicine.
Yes. Could you
Thank
tell
you.
us a little bit about that?
A little bit about tissue viability.
Yes,
Well,
please.
actually, I spent a major chunk of my years in dermatology. So I just became proficient in different parts of dermatology, which is skin, which is treatment of skin diseases. Mostly, I treated psoriasis and eczema with what you call light treatment. It's phototherapy, it's similar to a sunbed, but it's definitely not a sunbed, and it's almost like a vertical. Uh, um, Vertical sunbed basically. Patients enter into that and it tends to burn, for lack of a better word, burn it off. You use use different intensity of light, and you graduate it every time they come in. And normally what that does, it works with emollients, and then it just pretty much burns off the psoriasis and eczema in the patients.
Well, thank you for this.
Yeah.
You know, while you're talking now, I just remembered one of the quotes I used in one of my recent presentations about the fact that the skin regenerates every 27 days.
Yes. Yeah, it
It's
does.
amazing, isn't it?
21 days,
It
yeah.
is, yeah, it's amazing. Well, thank you very much. So I don't think I really need to read more of your bio, but I would just say Lydia is the founder and leader of the Kingdom Love International Network, which is a based faith platform for women with intercession, missionary support, discipleship at the core of this platform. So, and I also remember, I think it must have been sometime last year when
Yeah.
you had to send some money because you do help people back in Nigeria and other African countries as well.
Yes.
I know today we're talking about PCO, but perhaps you want to tell us a little bit about that.
Oh, well, yeah, it's basically almost, it's a charity organization, not like one computer. It's a charity organization basically catering for missionaries, really, because missionaries usually are part of the forgotten ones out there. They go up, and they're off their whim to win souls, to go into remote areas where it's hard to reach and really not very popular. Not very many people want to go there. Reaching people with the love of Christ, reaching people with love in a practical way. They take things, like clothing, food, distributing Bibles, distributing things, that were just basic life amenities, basically.
Yeah.
And so we support them, and sometimes we take those things out there for them. We collect them here, we ship them out. Also, we do medical outreaches because most people in our group are healthcare professionals. So anyone who needs us, basically we do medical outreach for them. And also we tend to also, just meet people's needs in terms of prayer, in terms of support, in terms of counseling. We run a prayer group every day because we believe prayer is pivotal to what we do, and also comforts people really who are going through different walks of life, different issues of life, really. So we're there as a resource for them. We also signpost them to where to get further help, better help as well. So really, it's almost like a holistic group.
Yes,
We
right.
cater for them spiritually, mentally, and physically,
Yeah,
psychologically as
yeah,
well.
yeah. Well,
Yeah.
thank you very much, and well done. Well done. It's a great work you're doing. Okay, so back to the topic of the day. So I've got a few questions here for you. I hope you're prepared. I'm sure you're prepared. Okay.
I hope so.
So, when did you first become aware of this condition called polycystic ovarian syndrome? And how did it affect you personally or professionally?
Well, thank you. That's a quite interesting because really I didn't even know that I had PCOS. I had the symptoms, and I know that it wasn't treated, and I know that I had, very, very scanty bleeding. It was irregular. Since from the age of 26, I noticed that I was retaining fluid each time that I did menstruation. And then with that, I developed hirsutism. And as a student nurse, I remember that I had a ruptured ovary, my left ovary. So my left ovary was removed due to cysts in it. But I
Mm.
still didn't connect all those things. And then I had really, really bad hirsutism, which grew every year. But
Mm.
it really wasn't treated. It really wasn't treated. It really wasn't. And even though my doctors knew that I had those symptoms, but it
Mm-hmm.
wasn't pieces together
Yeah.
called PCOS. Yes.
Mm.
It wasn't until you won't believe it. It wasn't until recently that then I knew when I had hirsutism, and then even though the doctor didn't diagnose me, but then I knew about 10 years ago that that was, that it
That
was
was what it
polycystic
was.
PCOS, and but
Mm.
I didn't actively treat myself.
Mm.
I So I just left it because at this time even though also I had difficulty conceiving, it took
Mm.
me a while each time to conceive.
Mm.
So
Mm.
we still didn't treat it. So it wasn't managed. At this time, I was aware of PCOS, but I didn't think that it affected me.
Yeah.
Okay. And
Yeah.
then I kept on gaining weight every year, especially post menopause. I had truncal obesity in
Mm.
spite of everything I was doing.
Mm-hmm.
And then that was when the penny dropped, and I thought, okay, this PCOS should have gone. Even though I went for treatment, my
Mm.
hirsutism actually got reduced, but it still came, I still had facial hair, and I thought
Mm.
at this stage of my life I shouldn't be having that.
Mm.
And then I went for treatment, and then I started embarking on researching about it, and really, really being conscious of getting rid of it. And this journey started like a year ago, 2 years ago, to be very honest.
Oh, wow.
And yeah, I started taking, like supplements, because I believe so much in naturopathy.
Mm-hmm.
Just looking for lifestyle and natural products to help me get rid of it, really, in the first instance.
Yeah.
Yeah,
Eh.
5 years ago, I had insulin resistance.
Mm-hmm.
No, actually, yeah, 7 years ago. But I didn't actually link it together. It was
Mm-hmm.
later on that I now found out that PCOS and insulin resistance were, like
One.
interrelated.
Yeah. One of the
Yeah,
same
and that
family.
was and I realized that in my community, it's not
Mm.
something, diabetes is very well known,
Yeah.
hypertension is very well known, but hardly anyone talks about PCOS,
Mm.
hardly
Mm.
anyone treats it. I mean, it's almost like just get on with it, live with it,
Yeah.
because
Yeah.
there are no very, very bothering symptoms to do with
Mm.
it, to
Mm.
deal with it. And so it's just been ignored, basically.
Yeah.
So until I just said, no, I'm going to take the law into my own hands.
Yeah.
I'm going to start treating myself.
Yeah.
Yeah.
Yeah. So your research led you to your
Yes.
diagnosis, so to speak.
Yes, he
I,
did. Yeah.
from what you've said, and even for the little research I did, I realized there's not much known about this condition.
No,
Even
no.
according to the uh, statistics again that I mentioned earlier about. Sorry, I want to get the right. Okay, so this is United Kingdom. It says talking about the healthcare impacts. I say women with PICO have a higher healthcare utilization. That means this condition costs the NHS close to
A lot more.
1.2 to over 1 billion pounds in 2019. Yeah.
Yeah.
And you mentioned about our community. We have a high incidence of hypertension, diabetes, which according to my research, you correct me if I'm wrong, PICO is a contributing factor to
Yes. So
diabetes
that,
and
yeah.
hypertension. That's
Very
correct?
true.
Yeah.
Yeah, very true.
Okay. So from
Yeah.
what you said so far, it seems there's to be more research that needs to go into knowing about this condition.
Yeah, very much so. Yes.
So
And also, I believe that there's supposed to be more cultural awareness, a lot
absolutely,
more education out there.
yeah.
Yeah, a lot more resource. Yeah.
Mm. So we're throwing this out there to the relevant authorities to do more research
Yes.
in this area to create more
Yes.
culturally and social
Yeah.
acceptable
Relevant.
education or
Yeah.
relevant, yes, relevant
Mm-hmm.
for
Mm-hmm.
people. And I was just talking to my colleague earlier before we started about so this month, especially next week actually, is Mental Health Week. And
Yes.
again, we're talking about how we've embraced that term, mental health, in our community. Have we embraced? Well, are we still embracing it? I know today is not about mental health, but it's just to show that some of these wordings, it often creates a barrier within different communities. So, what do you say about that?
About
No,
is it
I
the
know you
myths
mentioned
and
about culturally relevant education. I'm just saying, or should I
yes.
say, do you agree with what I just said about the mental health as well?
Yes, I do.
Okay.
I very much so. Because PCOS itself leads to increased risk of depression,
Mm-hmm.
anxiety, and mood swings.
Yeah.
And like I believe that in our community, mental health issues are not myths, and because of the stigmas associated, is
Mm-hmm.
either then they're misdiagnosed or not even diagnosed at all, or not even recognized.
Mm,
So except someone is really, really almost, like overtly mentally ill,
mm,
um, sometimes depression goes on unnoticed or undiagnosed, anxiety and mood swings,
mm.
and that comes as a result of the hormonal imbalance in the
Yes.
PCOS.
Yeah.
So it's very much associated with that.
Mm,
And
mm,
in our community, more awareness needs to be known,
mm-hmm.
because I remember after I had my son, I almost had a breakdown
Mm,
as a result of this PCOS, which was the undiagnosed
mm,
completely,
mm,
but it still wasn't addressed. It was
mm.
after I started, after it was that like a retrospective
Effective. Yes.
um awareness that made me, oh
Mm.
wow.
This
So
is what it
all
is.
this while that I left this PCOS untreated,
Mm-hmm.
these were all the symptoms and all the causative factors
Mm,
of all this, it wasn't so much depression, it was
mm,
almost like a break. I know
mm.
that childbearing and childbirth also was a causative factor,
Mm-hmm.
but because my hormonal issue, the PCOS, was not addressed,
Mm.
it actually compounded the issue.
Yes.
And because in my community it goes unnoticed, so that again was swept under the carpet. So
Mm.
really, there was a lot of needless suffering
Yeah.
when,
Yeah.
because of lack of education and
Education.
lack
Mm.
of and
Awareness.
ignorance, basically.
Yes,
Yeah,
that's
lack
right.
of awareness. Yeah,
Mm.
yeah.
Absolutely.
And I,
Well.
I think that the partners of the people who are, or us are also largely need to be educated so that they
Mm-hmm.
could know how to address and
Mm.
help
Mm.
people who,
Absolutely.
who suffer from that.
Yeah.
Yeah.
Yeah. Well, thank you for that. So, what's one myth or misunderstanding about PCOS that really needs to be corrected?
Okay. Well, there are quite a few,
Mm-hmm.
and if the truth be told, that this one myth that it's very common even in textbooks is that PCOS only affects overweight women. But the truth is
Mm,
that first of all, affects all body types. While weight gain can be a causative factor or a symptom,
mm,
lean women also can have PCOS,
mm,
and that one is called lean PCOS. So it's a myth that it's only people who
mm,
are overweight that have it. And also, it's also a myth that PCOS is a productive issue. It's not a productive issue; it's a hormonal issue.
mm-hmm.
Yeah, yeah.
Yeah. from my little research, when you talk about not reproductive issue, it's actually an hormonal issue, like you said,
Yeah,
that happens
endocrine.
during
Yeah.
during the reproductive years of a woman.
Yes.
So
Yes.
perhaps that's why it's being referred to
The
as a
link. Yes.
reproductive
Yeah.
issue. Mm, okay, and that's also a very valid point about the partners also need to be educated so they know how to support the woman better.
Yeah.
So, what are some of the main symptoms? I know you mentioned some already that women
Mm-hmm.
should look out for.
Yes. Well, there's quite a few.
Mm-hmm.
Well, the symptoms of it, there's cardiovascular health, there's, like I said, insulin resistance,
Mm-hmm.
there's irregular ovulation. Also, like I said, there's high androgen levels, higher than normal. So,
Mm,
yeah, and also there may or may not be symptoms of cysts, you
yeah.
know, cyst in the ovary. So
Mm,
the name is a bit confusing because it doesn't always cysts don't always have to be in the ovaries really to be diagnosed with PCOS.
okay.
Okay, and also yeah, we have hormonal imbalance as well if it's not treated.
Mm-hmm.
Okay, yeah, these are symptoms to look out for. Especially sometimes you also get irregular and infrequent menstrual
My
cycles.
cycle.
Sometimes
Yes.
some people don't even get cycles at all. And
Wow.
the opposite spectrum is that sometimes heavy bleeding when periods
Mm,
do occur can also happen in PCOS, and
mm,
also a very common feature is acne in the face, skin
okay.
problems. Hirsutism is very common in women. That is hair growth on the face, the chin, chest, abdomen, and back. And
Mm,
also, maybe later years, it can be characterized with skin thinning and thinning of the hair and hair
mm-hmm.
loss on the scalp. So sometimes you could have permanent or temporary alopecia as well.
Mm, mm.
And
Wow.
there's enlarged ovaries containing multiple small fluid-filled sac. You may or may not have that. That's part of the symptoms. But
Mm,
these that can be visible, can be ascertained on the ultrasound scan.
okay.
Also, you might not always have, may or not may or may have bloating as well during your periods.
Mm,
And that hence sometimes that's why the truncal obesity and the discomfort during menstruation.
okay. So
Yeah.
discomfort as a result of the bloating, or is it?
Yes, sometimes, yeah, both. Already there's truncal obesity, and then you can imagine when there's distension as well as as a result of fluid retention, there
Mm-hmm.
can be there can be discomfort that leads
Mm,
to epigastric pain, chest pain as well can be associated and confused
mm,
with
mm.
cardiovascular issue. But yeah, it also can lead to cardiovascular issues as well.
So what I'm
And
hearing that, go on.
fertility challenges as well is
Mm-hmm.
very common.
Mm-hmm.
Sometimes there's absence of ovulation because of due to irregular ovulation and also difficulty getting pregnant.
Mm,
People have been known to be infertile it depends on the degree of the severity of the PCOS.
mm, mm. Wow.
And mentally as well, you get increased depression, anxiety, and mood swings, like I
Mm,
said.
mm, mm.
Okay.
Thank you. Which brings me to my next question, but you've already answered it. So what I'm hearing is that PCOS is not just a reproductive condition, it affects everything from your
And
mental
yes,
health,
metabolic, yeah.
yeah. Wow. So it's a big deal, really. We need to,
Yeah, it is. It's more big deal than people give it credit for. I
yeah.
think it's really been underplayed, to be
Mm,
honest. It's one of the diseases that has been undermined. The effect of it on life expectancy and quality of life has been
Mm.
really, really underplayed and undermined, to be honest.
Wow.
Yeah.
Wow. Well, I'm glad you're here today to educate us. Thank you.
Thank
So, I still have some more questions because we're being educated
you.
by you today. So, what role would you say? Actually, before I come to that, how's PCOS diagnosed?
Okay. Well, there are no single tests for PCOS, like I said,
Mm.
because of the multiple symptoms and
Mm-hmm.
comorbidities as well. So diagnosis is usually made based on a combination of symptoms, really,
Okay.
um, through blood work, imaging, often using the Rotterdam criteria, which requires two or more of the following, which is number one, irregular and absent of ovulation based on your
Okay.
history. So evaluation through menstrual history, cycle tracking. Also, the blood tests assesses hormonal levels relating to ovulation, like like progesterone, LH, follicular
The
stimulating
stimulated,
hormones,
yes.
and then signs of high androgen is one of the also another
Yeah.
telltale factor.
Mm,
You know,
mm,
physical signs, acne, hirsutism, hair thinning, blood test shows elevated testosterone level of DHEL level.
mm,
Also,
mm,
polycystic ovaries on ultrasounds. When
mm,
you have transvaginal or pelvic ultrasound, 12, and small follicular lesions are in the ovaries, then you could
mm.
say, and then you have a combination of one, like those two, not just one symptom, but of the
Yeah.
three I mentioned, you have at least two of that.
Of those.
Then
Okay.
you could diagnose. And other tests that can be done to diagnose it is thyroid function test, like I said. So high blood sugar levels or insulin levels also could be tested, could be checked.
Okay.
It won't really come out as HbA1c on the
Yeah.
HbA1c like a sugar level, but it will come out if there's a fasting blood sugar level. That will
Okay.
you have to be tested on fasting blood sugar level, not the HbA1c,
Mm-hmm.
because sometimes when you could have normal HbA1c, but you could have insulin resistance, which will just come up only when you're doing fasting blood sugar
Fasting.
levels. And when
Okay.
you check your cholesterol and lipid profile, if those ones are high as well, you know,
Okay.
that
So it
could be,
sounds
yeah.
like there's a lot of, well, I was going to say options, but there are lots of
Yeah.
symptoms. And once you have two, at least two of those, is indicative of
Yeah.
PCOS.
A
Okay.
a big giveaway sign for me, maybe because
Mm-hmm.
I've experienced it. If
Yeah.
someone just comes to me and I see that they have really bad hedgesism, facial hair,
Mm-hmm.
like really, really, because
Yeah.
ethnically, you get some people in some tribes, like where I come from originally, they really have massive facial hair.
Mm,
And when I look at them and I see that they, they've got truncal obesity,
mm,
I ask them a few other questions.
mm-hmm. Mm,
About themselves, how were their fertility, this, that, and the other, and immediately I tend to know that they
mm,
probably have PCOS, which
mm.
has gone undiagnosed.
Yeah.
Yeah,
Okay. Thank you for that. So you've explained to what the facial hair is. I was trying to use that word,
yeah.
but I'm going to trip over that. So I'm not going to say it.
It's a mouthful, isn't
Eh,
it?
Same thing with this PCOS. So we're going to stick to the PCOS.
Yeah, and facial hair.
Yeah. But you mentioned androgens. Now I know what androgens are. Perhaps you want to explain to our viewers and listeners what androgens are.
Yes. It's just simply put, male hormones. We have it too as females. So, we have progesterone, we have androgen, we have estrogen.
Mm,
But androgen is higher,
in
like
men.
testosterone and androgen level is higher in male. It's supposed
Mm,
to be, like a male hormone,
mm,
more predominant in them. But if androgen levels are high in
mm,
females, obviously then it leads to facial hair, and
Mm,
androgen level is just part of the male hormone
mm,
system, really.
mm, mm. All
Yeah.
right. Thank you for explaining this. So, one of my favorite things to talk about, lifestyle, I think, as well as yours,
Uh,
actually.
yes.
So,
Yeah.
what would you say about the role of diet and exercise in managing PCOS symptoms?
Thank you so much. That is so PCOS, like because it's a really, really is a very, very big key player in actually keeping PCOS under control, and dare I say, even at bay. Some people, I know someone who's been cured from it. I mean, she's even on YouTube. She dared out to say from actually changing lifestyle. Should we go through the whole role of diet? You
Yeah,
know,
let's talk about diet a bit. Yes.
let's talk about diet first.
Yeah.
Actually, it says diet, lifestyle, and exercises plays a fundamental role in managing PCOS
Mm-hmm.
symptoms, just like all other metabolic issues, and can be reversed by with lifestyle. So often as the first line of treatment, even before medication, PCOS is deeply connected to insulin resistance.
Mm-hmm.
So, as is all connected to inflammation in the body, especially chronic inflammation, is connected to hormonal imbalance. So, therefore, these are metabolic issues that can be reversed with lifestyle changes, and they can lifestyle changes can directly target these root issues and
Mm-hmm.
bring significant improvements in symptoms, really. So like irregular periods, acne, weight gain, fertility challenges, and mood swings. So the role of the diet really is, take for instance, low glycemic index diet.
Mm-hmm.
That helps regulate blood sugar and
Mm-hmm.
insulin levels.
Mm-hmm.
So it includes, and this includes whole grain, legumes, vegetables, fruit, nuts, and seeds.
Yeah.
And when they avoid refined carbs, white bread, sugary snacks, that also helps to regulate blood sugar.
Mm-hmm.
It helps to reduce calorific intake,
Mm-hmm.
like anti-inflammatory foods also. Research has shown that alkaline diets are
Mm-hmm.
like anti-inflammatory foods, like
Yeah.
they reduce chronic inflammation in the body anyway.
Mm-hmm.
And also this includes berries, leafy greens, turmeric, omega-3 fish, 3 rich fish, olive oil. And then we need to have balanced diets, especially balanced micronutrients,
Mm-hmm.
which ensure meals contain protein, healthy
Mm-hmm.
protein, lean protein, healthy fats like avocado, and complex carbs to prevent insulin spikes and
Mm-hmm.
keep you fuller for longer, and lead to satiation.
Yeah.
And limited processed foods and sugar reduces insulin resistance,
Mm-hmm.
and also it reduces hormone disruption. So regular meal timing is really, really also important, because that helps to stabilize the
Oh,
hormones
wow.
and to avoid blood sugar crashes.
That's right.
So, and let's look at the role of lifestyle, i.e., exercise.
Mm-hmm.
So, managing PCOS benefits, the benefits of regular physical activity. It improves insulin sensitivity.
Mm-hmm.
Both cardio and strength training helps your body use insulin more effectively, and also it supports healthy weight management.
Mm.
So even a 5 to 10% weight loss can significantly improve symptoms and restore ovulation in many women. Uh,
Wow.
I remember that happened to me before I had my second child. I was told that I had to lose weight,
Mm.
and I did, and then I conceived naturally.
Wow.
So even though I conceived at 38,
Mm.
yeah, it took me 6 years to conceive
Wow.
in naturally. So I mean, these things work.
I
I
was
mean,
gonna say.
I wouldn't be this passionate if it didn't work.
Mm.
And because it's not just a textbook thing, it's not just something that I know professionally, it's something that affected my own life
Yeah.
as well. So I know it works. And regular mood and exercise helps to regulate the mood. It
Yes.
helps to reduce stress as well
Mm-hmm.
because it boosts endorphins.
Mm-hmm.
It lowers anxiety and depression, and often that is often associated with PCOS. So
Mm.
exercise helps the mental health and also helps to balance hormones. It helps to reduce the testosterone level
Mm.
and increase ovulatory function. So, and well, the most effective workout that with the research has shown that helps PCOS is usually the strength training two
Mm-hmm.
to three times per week.
Mm-hmm.
Cardio helps, brisk walking, swimming, cycling, like 30, at least 30 minutes most days.
Yes.
And also HIIT, high intensity interval training, short burst of activity. You would know your
Yeah.
your your
Our 5 a.m.
that's off
class.
your street. Yeah. And also meditation, meditation helps. I'm a Christian, so I believe in, like biblical meditation,
Mm-hmm.
or the word positive meditation for stress reduction and hormonal balance and
Mm.
pelvic health. And dare I say, another favorite, deep breathing exercises.
Absolutely.
You can't believe it. It actually even lowers your blood pressure
Mm-hmm.
instantly. The
Mm.
breathe, and also it helps PCOS. Another lifestyle habit that needs to be incorporated is sleep hygiene, seven to
Mm.
9 hours a day. Chronic management, chronic stress management,
Yes.
because chronic stress raises cortisol levels,
Mm-hmm. Mm-hmm.
which can worsen insulin resistance and
Yeah.
hormonal imbalance. So we need to, like I said, practice. I can't say that enough. Practice deep breathing, prayer, journaling, quiet time daily. It helps. I find that
Mm.
it has really, really helped. And aiming for 7 to 9 hours of sleep, like as you would know, I used to suffer from insomnia,
Mm.
and I used to even I didn't really do much about it. And
Mm.
until last year, I took time off work, and all I did was sleep,
I
and
remember.
really, really, you remember. And that alone, that act alone helped me,
Mm.
just really, really helped me in very many ways that I can say. It even helped me to feel a lot younger and
Mm.
youthful. It really reduced stress. It really helped my mental health, gave me
Mm.
more mental clarity.
Mm.
You know, honestly, I mean, I can't really overemphasize the benefit of sleeping
Of
that
sleeping.
over
Yeah.
we tend to ignore.
Mm.
It
Yeah.
and also poor sleep affects hormonal regulation. It
Absolutely.
makes us hungry, causes stress, and it affects metabolism as well.
Mm.
So we need to avoid endocrine disruptors as well. I need to put that in. We should limit exposure to plastics,
Mm-hmm.
parabens, and certain chemicals that affect hormone balance, which
Yes.
has found in skincare products,
Yeah.
in food packaging, in maybe some quite a number of skincare and hair products, especially that
Yeah.
we use in our
Mm-hmm.
ethnic community as well.
Mm-hmm.
So, and then we choose consistency over perfection, and small changes
Absolutely.
here and there, sustainable changes in diet, in movement, in mindset. It leads to a long-term result.
Hmm.
Sorry, that was a mouthful, but
Yeah.
so
Thank you. Thank you for that. I mean, you've answered the next few questions I have for you, which is great. So, thank you. So, I want to
thank you.
talk about you're welcome, sis. About some of the cultural and ethnic perspectives of PCOS. So, one question is, are there differences in how PCOS presents and is treated in women from different ethnic backgrounds, especially our community versus our Caucasian sisters and other people from different communities?
Yes, yes, yes. That is a big question.
Mm.
And how do I start to
Let's
to
unpack
address
that.
that? To unpack that. There's a number of issues there.
Mm.
Quite one of it is accessibility to healthcare. You know, number one, how often do people in the Bain group go forward. There are important cultural and ethic differences in
Mm-hmm.
how PCOS presents itself in the first instance,
Yeah.
and how it is diagnosed and is treated, especially between Black, Asian, minority groups and white Caucasian women. These differences are influenced by biology, we know that, biological makeup, environmental makeup, healthcare access, cultural norms, and systemic biases.
Mm.
Let's face it, let's break it down. So, PCOS contains symptoms can vary in severity and types depending
Mm-hmm.
on our background due to genetics and metabolic differences. So, common features really in Black people in Africa of African descent, we have higher risk of metabolic syndromes. So we see that type 2 diabetes is a common
Mm-hmm.
thing among hypertension, often
Yeah.
report more severe hirsutism and central belly obesity,
Mm.
while South Asian, tend to have earlier onset of symptoms, more pronounced insulin resistance, and higher risk of diabetes and cardiovascular disease,
Mm.
even at lower BMI. But the East Asians may have milder androgenic symptoms, less acne, hirsutism, but high
Mm-hmm.
risk of ovulatory dysfunction and metabolic complication.
Mm.
White Caucasians, on the other hand, they often present with a more classic PCOS profile, like irregular periods,
Okay.
acne, weight gain, and facial hair, more easily recognized, and is more easily recognized and diagnosed.
Mm.
So
Mm.
the key insight is like the Caucasian population, maybe they have more access maybe to private healthcare or to the healthcare service. So symptoms of women of color as a result may go undiagnosed or
Mm-hmm.
under recognized and misinterpreted. Not so much because there's a disparity, but because they don't go forward.
Mm-hmm.
Maybe because of lack of education, lack of
Yeah.
funding, they
Yeah.
don't really even go forward
Mm.
to be treated. Like as in my case, I'm a healthcare professional, a little bit enlightened about these things, but
Mm-hmm.
yet I didn't actively do anything about it.
Yeah.
I mean, really it should have been picked up on my profile, but that goes to show that we need to take our own health in our own hands too. We need to be more proactive and say, listen,
Yeah.
these are the symptoms I'm going through. I
Yeah.
want to have it seen to, and we need to push through.
Yes.
Uh,
Mm.
because sometimes it's the one who speaks the loudest that actually gets heard.
Good. Yeah.
Um,
Yeah.
yeah.
Oh, thank you. Thank you for breaking that down.
And you could see the sometimes economic disparities as well can
Yes.
limit access to healthcare. You know,
Absolutely.
um, if you don't have enough funds financially, you can don't have access to healthy food, fitness
Mm-hmm.
resources,
Mm-hmm.
and stretch management tools as well.
Yeah. Yeah.
And sometimes doctors, even when you go and have it done and want to have it seen to, doctors may just focus on weight loss alone, and sometimes they just give you the pills and
Mm.
just say, okay, when you lose weight, everything is lose weight. And sometimes when you have PCOS, it's much more difficult to lose weight. So you need,
Mm.
okay, take for instance a big marker. I so I went to my doctor for weight loss biologics, like weight loss injections. And I was told because I didn't have hypertension,
Mm.
no diabetes, I couldn't get access to it. And
Mm.
that's it. There's no criteria for,
Mm-hmm.
even though I have PCOS,
Mm.
they don't recognize that as
Mm.
okay, it's not enough. My symptoms are not enough for
Yeah.
me to, so it's like prevention is better than cure. So until
Absolutely.
it goes into full diabetes, I don't qualify for
Mm.
it. So I
Mm.
have to
Mm.
go private.
Mm.
And people like me, in the community, they are at a disservice as a
Mm.
result of that.
Mm. Mm. Oh, wow. There's so much you said there. Um, of course, there are some areas that we're having health promotion initiative and other other areas when it comes to issue with diabetes, high blood pressure, or
Yeah.
hypertension. Yeah, so we're having help in those areas.
Yes.
I mean, I'm sure our viewer and listeners are enjoying the show. I still have so many questions, but we're running out of time. So I'm going to ask two last questions. So if you make them a little bit
Okay.
short, then we can round up.
Okay.
But so it sounds like I'm going to have to invite you back onto the show. So
Thank you.
that's my hint at the second invitation. That's a yes,
Thank you.
right?
Yeah,
So,
what can I say?
yes. So, what
Good.
advice would you give to someone that's newly diagnosed of PCOS who is feeling overwhelmed? What would you say to them?
Um, well, I'll just say to people that hope is not lost.
Mm,
There are places, there are things that can be done to improve awareness and access to
mm,
service in the UK. So, like for instance, you can have culturally sensitive health education is out there.
mm,
You need to self awareness and self education is the most, because to be very honest with you, even the NHS is going that way. You need to take your health in your own
yeah,
hands.
prevention.
There are so many different treatments that we don't have, possibly don't have time to go into
Mm-hmm. Mm,
um, at the moment. So apart from health lifestyle intervention, which
mm,
is very good, there's also medication
mm-hmm.
that can be given to you if you have it. And also there are so many other herbal remedies out there
Mm,
that can be used where we don't have time now, and supplements that can be taken.
mm,
Also, just read up as much as you can,
yes.
and try and make sure that you talk,
Mm,
um, because so many people out there, you can get pregnant naturally. Don't
mm-hmm.
actually be part of the people who actually um, take that myth and say, well, right, because as a result of that, that's why I'm going through this.
Mm,
No,
mm,
try and make sure that it, it's completely natural to feel overwhelmed,
mm-hmm.
especially if you're newly diagnosed, but
Yeah.
especially with a wide range of symptoms,
Mm,
potential health implications. But you can take it one step at a time, focus
absolutely.
on what's in your control,
Mm-hmm.
break down
Mm-hmm.
your goals into manageable steps,
Yeah.
educate yourself about PCOS, reach out
Mm,
for support,
mm,
talk to your doctor, talk to your specialist, talk to your mental health. There's mind that you can there's so many things that you can self-refer yourself
yeah.
to, especially when it's mental health.
Mm,
There's group support out there. All you have to do,
yeah.
Google PCOS in the
Yeah.
UK,
Yeah.
and all the resources will come to you as well.
Okay. Right. Wow. Thank you so much for coming today. Thank you for all the
Mm,
nuggets. Thank you for sharing your personal experience as well as your professional insights.
okay.
We are so, so thankful. So there
You're
you have it,
welcome.
viewers. Thank you for listening. And like I always like to end the show with, let us get wealthy together by staying healthy. I've been your host, Yinka, with my guest, Lydia, today. Take care and see you next time.